Looks beautiful.
Okay, wonderful. Well, thank you, everybody. And this is our first time presenting, so really enjoyed all the other presentations. And just as an entrepreneur at heart, just really appreciate the passion of the founders and the innovations that they've brought forth. But this is my name is Mike Shear. I'm Chief Financial Officer for Reach7 Diabetes Studios. This is a cash flow investment opportunity. And when you look at the anatomy of an investment or an investment opportunity, there's four things you really want to look at, right? What is the market opportunity? What's the team that's going to pursue that market opportunity? What solution is offered? Its uniqueness and viability, and of course, what kind of return can you get on that investment, right? Well, as I mentioned, Reach7 Diabetes Studios, the market opportunity is really serving the diabetic, pre-diabetic, gestational diabetic, and those looking to lose weight. It's serving that market. Okay, there are very simply the market opportunity. There's a growing number of folks with diabetes. 40 million Americans have been diagnosed with diabetes. About another 10 million have it and don't know it yet. And there's just not enough specialists to serve that community. Endocrinology, the specialty that serves diabetes, is a dying specialty. There are only 8,000 licensed endocrinologists in the United States, so we just really have a problem and an access problem. Okay, but what we don't just need more medical practices to address diabetes. We also need to change how these practices address diabetes. The typical way that we treat those with diabetes is very short, ineffective appointments, seeing people every 3 to 12 months. The patient experience is really very poor. Often going into, where you go into a medical doctor's office and they're double, triple booked, and you're waiting in the room for 30 minutes, et cetera, before you even get seen. And then you see the doctor for, 3 minutes, 5 minutes, whatever it is. You get prescribed and something, and then they say, come back and see me in 6 months or whatever. And you're really left on your own. It's not great for the patient. It's not great for the providers. A lot of staff burnout, and typically you're talking about a 2,500 to 1, 2,500 patients, for a practice like that. What needs to change is much more frequent engagement, have access, particularly with diabetics, is bad things can happen to them at any given time. And it's not just a medical solution, it's a whole body type solution in terms of mind, body, and soul. So what it really needs to change is something that is much more engaging, much more accessible, someone who advocates for them and really doesn't get caught up in sort of the insurance, where insurance is basically dictating what procedures are. So we have the team, and a couple of folks I'm going to highlight on this team. Our CEO and co-founder, Chun Young. Chun is a biomedical engineer. He has been involved in diabetes research studies. He's been published on those research studies, and he is also, as a result of all that experience, has become an inventor of years ago of some early stage clinical AI solutions to help doctors treat diabetics at a greater efficacy and a greater scale. And then there's Dr. Jason Berner, who is an endocrinologist. He's an Emory-trained endocrinologist, been practicing for more than 15 years, got a robust practice in quasi-rural area, Canton, Georgia, but has always been an innovator and leveraging new technologies. The rest of the team has combined 100 years experience in healthcare operations, clinical, and finance. So all this has, the team, the experience, all has come together to create the solution called Reach7 Diabetes Studios. And I think Jim mentioned earlier about concierge medicine being the rage. This is a membership-based concierge clinic in a retail setting that is located where people live, work, and shop. So bringing that experience and making it as convenient as possible for folks, and using the latest and greatest in technology in order to help deliver care with mid-level practitioners versus having to deal with endocrinologists, and which just aren't available. It's a welcoming environment. The space is about the size of a Jersey Mike's sub shop, if you can, about 1,500 square feet. But it's space and lobbies where you actually want to hang out in, not your typical medical facility. Exam rooms and education rooms that don't feel like exam and education rooms, but they're warm and inviting, and having a team that can really treat the whole person. So it is, as I mentioned, it's membership based. The membership is focused on three things: access, advocacy, and outcomes, right? The way the engagement works is we start with a screen. As I mentioned, about 25% of people who are diabetic don't even know it. So we do that for free. They come in, we educate them on things from lifestyle and options and medications and things like that. They sign up for a membership. They walk out with some monitoring devices so we can be with them 24/7, and we help manage them not just medically but spiritually, and then also from a diet and lifestyle as well. Okay, these are all the elements that we touch in terms of our monitoring and engagement. We're kind of like the ADT for the ADT security system, but not for your house, but for your body. So when something goes wrong, we get the alerts, we understand what's going on, we understand how to triage it and stop bad things from happening. The membership, it's a cash pay business. It's a $299 a month membership. What does that give you? Well, it gives you, like I said, access, advocacy, and outcomes. Access, basically a Disney Fast Pass. You have access to a diabetes specialist 24/7. Low to no wait times to come in and see us, a dedicated medical team. All your tests are involved, your monitoring equipment, your medication optimizations, your prior authorizations. You get advocacy where we'll work with whether it's your family members, a spouse, a parent, a child, and your care team, and be part of that care coordination. And then we do things like hold events and classes on meal planning and shopping and helping you understand, how to live a very, very healthy lifestyle, but really just being there when our members need it. Okay. The staffing of one of these 1,500 square foot facilities has a provider. Ultimately, when that's a nurse practitioner. Ultimately, when it's fully built out, there are two providers, one dietitian, a studio concierge, and it's all supervised by a medical director. We are open. If you go to Reach7, www.reach7.studio, or you Google us, you can see our Google reviews, all 5 stars. And what's the investment look like? Well, this is a little bit different investment than maybe, than some of the technology investments. The idea is that this is a cash flow investment where to own 50% of a studio, you get it's up to 850,000, or you don't have to come up with the whole 850,000. It could be partial of that. That's for 50% equity in each studio. What happens with that investment? We hire and staff and open the studio. It takes about 3 months to open the door after we sign the lease. It takes about 8 to 12 months from the opening for the studio to start reaching profitability. We distribute cash back to our investors. This isn't just give us money and then maybe down the line, you'll hit it big. This is, we want to get you your money back to you and then give you an opportunity for a nice exit. Okay. And then within 12 to 18 months after opening, that's when we reach max capacity. What's the return for a studio? Well, it's 1.8 million top line revenue, annual recurring recurring revenue. The return is approximately a 35% cash on cash return. So you get your investment recaptured in about 42 months, and then an exit in 4 to 5 years. And we have one location open. We are getting ready to open up our second location, and we have other opportunities available where we have providers and we're ready to go. So I'll go ahead and take some questions.
Great presentation. Thank you so much. Let's open it up for questions.
I'll just make a comment. My background is endocrinology. And for me, I feel if you're dealing with any medical issues, you do need to go to the appropriate specialists that deal with those areas. And these days, even if you ask, say, one specialist to deal with one issue, they won't do it. So that was one point. And then why would someone, when we have high cost medical insurances, want to pay out of pocket? And these days, most people know you should diet, exercise, and there's a ton of apps out there. So those are my 3 major concerns.
Okay. Were they concerns or were there questions involved in that?
You could address them too.
Sure. So so first of all, all the things you cited are factual, right? However, with the exception of we are diabetes specialists. That's all we have. All the latest therapies. We're supervised by an endocrinologist. When you dive into the clinical AI and you see how that supports what we're doing here, it's quite robust. Why would you go here and not? You can't get in to see an endocrinologist. In Columbus, Georgia, there are exactly 2. One doesn't take any patients, and the other has a 9 to 12 month wait. So you can't get in to see them. We're creating access for these folks. And your other point was why, there's a bunch of apps and things like that. And hey, all the more power to you if you can do it on your own. There's also a bunch of apps to exercise at home, but people get personal trainers and gym memberships and things like that as well, because they need more than just that that motivation themselves, right? They need a coach, and then it's just they can certainly do it on their own, and people can, but most don't.
And why pay out of pocket?
Oh, and why pay out of pocket? Again, partially because even with insurance, right? And people pay out of pocket for lots of things, right? They pay out of pocket for laser vision correction. They pay out of pocket for massages. They pay out of pocket for chiropractor. So this is just something else. If you want to feel better and be better and thrive longer, we have seen that people pay out of pocket. I mean, we have people paying out of pocket each and every day.
So, Michael, I think your presentation is excellent. Your Mike Jersey, kind of a retail shop is a good experience, including the spiritual one. I feel this is a very beautiful model. Question: what is the feedback you're receiving from the investment or investor community?
So it's a great question. The feedback's been a little bit varied, right? One of the feedback has been, hey, it depends on the nature of the investor themselves and their sort of profile or tolerance or focus. Some are, hey, I don't want to do one, right? I want to do 50, right? I don't want to just be invested in one. And we'll certainly entertain private equity or venture capital investments to build this out. Some of them are saying, hey, well, okay, you got one open, you're opening another one. We'd like to see 2 or 3 open. That's fair, right? Mm-hmm. Part of the reason why we're offering the investment we are is we realize we are earlier stage and people are taking a higher risk. And other people are saying, hey, I don't want your cash distribution. I just want to I just want you to reinvest that. I said, well, hey, if you want to reinvest if you want to invest in location 3 and take your cash investments and invest in number 4, that's up to you, but we want to honor your capital.
Thank you.
Thank you all so much. We've got 10 seconds left.
Hey, Michael, this is Ramana. I'm from Georgia. I know very well. I placed doctors in Cummings, Georgia, J1 physicians, underserved areas. So, can you tell us a little bit about it's a great idea. Why don't you put in the primary care offices your studio? Have you thought about that?
I'm sorry, can you repeat that again?
Can you put your studio in the primary care offices, primary care centers, rather than separate itself?
We could, and we've had some discussions with some folks about doing that. There is but typically those primary care facilities are in medical office settings, which is not out of the question. It's just that in a concierge environment, we want to be a little bit closer to where people live, work, and shop.
Thank you guys so much. Sorry to rush you off, Michael, but I know that we're really behind, and I know
No, we appreciate your time. Thank you very much.
Great presentation, great question.